Welcome to the Truth and Fertility podcast. I'm Haley, wife, mom, and a fertility charting instructor, here to teach you the undeniable truth about your fertility. So let's get started. Welcome to the Truth and Fertility podcast. Today I am interviewing Emily Jurschak. She is a pelvic floor physical therapist, or a women's physical therapist. And to be quite honest with you guys, I am meeting her just for the first time, as well as you guys meeting her just for the first time. So I am really excited to get into this topic of pelvic floor physical therapy. It's something that I myself have knowledge about and have gone through, and it was amazing. It was so incredibly helpful. And so I'm really excited to just pick her brain today and have this conversation about this specific type of physical therapy and about her practice and what she does specifically to help women. Now, I know Emily was saying that she is in the Virginia area, but looking on her website, I also see that she does virtual stuff. So I'm really interested to see how that even works. So, Emily, thank you so much for being on today. If you could just introduce yourself, introduce your practice, tell us a little bit about you.
Thanks, Haley. It's really nice to be here. My name's Emily. I've in Virginia, and I've been working in physical therapy for, since 2018, I guess. And I initially started doing orthopedics. I did a residency in orthopedics up in Maryland, and found that I just kind of kept getting that nudge, that call to work in the pelvic floor, pelvic health field. Was totally not interested initially because I just thought, that's an area of the body that I was not interested in working in. I didn't know anything about it. They actually don't teach you too much about it. I think that's changing in physical therapy schools, but we learned minimal about it. There was an elective that I did not take while I was in school. But I kept getting that nudge, eventually said yes to it, took my first course, and fell in love with it. I love working with women. I love working with everything from pelvic pain to pregnancy and postpartum to menopause. There's a whole spectrum. It's really a whole female lifespan, which is really fun and nice. And it's so much more than just the pelvic floor, because of where it sits in the body. And so everything that you do affects it, because it is part of your core, and you need your core for everything. You just don't need to know that you're using it. And so helping to train someone's body to get there is quite fun. I started my own physical therapy practice, Fiat Physical Therapy, in 2021. And it has been an absolute blast. Seeing a whole host of different people. No patient's been the same. And yes, I also treat virtually. And that is to say, so first of all, virtual treatment's really, really effective. You can do a lot virtually. And I'm licensed in Virginia, but outside of Virginia, it would be considered like a consult. So you just can't reimburse with insurance. But that said, I don't usually see people with a ton of frequency anyway. I kind of expect people to be able to do some stuff on their own. Or I also recognize that there are very busy seasons of life where maybe you don't get to your physical therapy homework. And so it takes some time to get there. But yeah, that's a nutshell, I guess.
Yeah, that all sounds incredible. I want to just go straight to the basics of like what even is the pelvic floor for those that have no idea what we're even talking about. Like what is the pelvic floor? What muscles make up the pelvic floor? Why you said it is affected by everything we do. Why is that?
Yeah, so so the pelvic floor, you think of your hip bones. If you put your hands on your hips, that's the top of your pelvis that you're touching. And it's a very bony part of the body. But there has to be something underneath it, or else everything falls out of you, right? And so it's actually lined by muscles. And so the pelvic floor is actually really, really unique in that it's not a muscle that crosses joints in the way that your bicep crosses your shoulder and your elbow. um, it it attaches to fixed bony points, and it doesn't move those joints. And so what it does have though, which is really unique, is it has three different openings. One for your urethra, one for your vagina, one for your anus. Obviously, men don't have um, three; they have two openings, um, but because of that, it helps to control bowel and bladder function, sexual function. It also works as like a little sump pump, so it helps to move fluid throughout that area, like your lymphatic fluid and whatnot. Um, and yeah, these muscles are sit at the base of your pelvis, but that whole pelvis and your core. So you think of your abdominal muscles, your back muscles, and you think of your diaphragm. That kind of creates this like canister. So if you think of a soda can, is probably the easiest way to think of it. So the top of that's your diaphragm, the bottom of that is your pelvic floor, and then you have your abdominal muscles and your back muscles as the surrounding parts of the can. And everything that you do, it helps to protect your spine, that core when you go to move. And so if you are to go reach overhead to pick up something from your top kitchen cabinet, you need to have a strong trunk in order to have some stability to pick that up and to move it, to protect your spine. Um, and the and essentially what happens is that it creates pressure in your trunk, and that pressure gets pushed out everywhere. So it gets pushed up, down, to the sides. And when a muscle meets that kind of pressure, it responds by contracting to meet that pressure. So you think, equal or opposite forces kind of a thing. And so your pelvic floor must be able to contract to manage that pressure. It also must be able to relax to allow for bowel and bladder function, to allow for sexual function. Um, and so, yeah, your pelvic floor has to be able to contract to fully relax and whatnot. I think that answers your question.
Yeah, yeah, it absolutely does. Now, I want to talk too about the connection, if there is any, between the pelvic floor and fertility. Because when you think of fertility and you think about fertility conditions, a lot of what we think about is hormonal. But
Yeah.
I'm so interested to know, okay, what about this is actually more mechanical? I guess maybe
Mm.
lacking better term for that. But what is actually, is there any other connection there from fertility to the actual pelvic floor muscles itself?
So yes. So it would mostly be indirect for the muscles itself. So you think that you have to be able to have penetrative sex in order to get pregnant. And so there are plenty of people, um, plenty of women, and I'll go into this in two parts. Plenty of women who are unable to have penetrative sex because it is so painful. And so in those conditions such as vaginismus, um, it's the muscles are either too tense or there's too much pain, which are two different things, mind you. You can have pain with tension, you can have pain without tension in the muscles. And so just because somebody has tense muscles doesn't necessarily mean that they're going to have pain. If it is too painful, if it is too tense, to allow for penetration, then that can certainly affect fertility. Then on the male side, pelvic floor muscle dysfunction. I don't treat men, but I certainly know about this. But pelvic floor muscle dysfunction can lead to erectile dysfunction. You can have difficulty um, ejaculating, all those things. So it can affect fertility from a mechanical perspective. Um, and it does. It certainly does. It's not as common as what we see in the restorative reproductive medicine space, working with hormones. However, hormones do also affect the pelvic floor, particularly in women, because there are a lot of estrogen receptors around the vagina, around the vulva, and that can change, that can affect prolapse symptoms, that can affect urinary incontinence symptoms. And so if you do have something like you are in a low estrogen state, such as menopause, or postpartum, you might feel those symptoms of prolapse or urinary incontinence, or which is just leaking, like leaking urine, when you cough, sneeze, lift, when you jump, things like that. You might see that more often in that postpartum or low estrogen state. So if somebody's having infertility due to low estrogen, or and that's related to that, you could also have some pelvic floor dysfunction. And so yeah, so women who might be having, kind of amenorrhea or whatnot might also have some pelvic floor dysfunction. That's completely possible.
That is really interesting, because especially talking about the postpartum phase, I mean, I've heard before that women are you can experience some incontinence or just leaking, as you said. But I always thought it was because, vaginal birth, okay, things are torn apart down there. And so clearly it's going to take time for that to heal and for that to become strong again. But I never made the connection before with it actually being a hormonal thing as well,
Yes.
with there being the estrogen. Can you go more into that, of like how do those estrogen receptors actually affect the strength of the pelvic floor?
So that
Or am I getting
it is related. No, I think you're spot on. It is related. So certainly, after a vaginal birth, things are stretched out a little bit more. That you have a lot of connective tissue that's stretched out, and so that can be related to some of the symptoms that you're feeling. So certainly, we absolutely have increased urethral mobility after vaginal birth, and there's also more movement of the vaginal wall after birth itself, which can be related to prolapse symptoms. Um, However, estrogen in these tissues is also going to help to like firm up it's going to help to firm up the tissues a little bit. And so particularly around the vaginal wall, the bladder and whatnot, it's going to firm those tissues up. And so if it's a little bit more firm, then you're not going to have as much movement. Um, and that's why you see, perhaps a prolapse symptom, or perhaps, the leaking issues, because that can be totally related to mobility of these tissues as well.
okay? Kind of moving into further into this topic too. What about with a C-section? Is that something that you see women struggling with pelvic floor health after a C-section versus a vaginal birth?
Absolutely. So it is a complete myth that women who have C-sections will not have pelvic floor issues. So, my heart
Mm,
really goes out to these C-section moms, because you're dealing with a surgery, an abdominal surgery, and a pretty significant one at that, where you go through several layers of tissue and whatnot. Um, but uh, because your entire pregnancy, you have this increased strain on your pelvic floor if you're not um, working out during that time. And it's not even just that; it's you know um, when you're postpartum, your whole body's different anyway.
right.
Um, and so, we don't have strength in certain parts of our muscles, like our hips get really weak, our core is weaker. Um, and so that can absolutely influence our pelvic floor's function, because again, if you go back to that soda can, if you have a soda can that is unopened, and you put a 10-pound weight on top of it, it's going to hold the 10-pound weight, no problem, right? But if you go ahead, empty the soda can, and stick a hole in the side of it, try to put that 10-pound weight on it again, it's going to crumble, right? And so that's effectively what's happening. You're having these imbalances in your body, and that's going to affect someone uh, regardless of their mode of delivery. But then also, you still have, you are still you still experience this lower estrogen state postpartum, especially if you're breastfeeding. And so then that's going to affect your pelvic floor as well. And so, you know, the worst is seeing someone postpartum who just had a C-section, thinking, I didn't think I was going to have this heaviness feeling, and in my pelvic floor, and I have it, and I'm so surprised. Now, they're not going to have they might not have as severe symptoms, or perhaps the mobility of they're going to have a little bit less mobility of the pelvic wall, so a little less distension. but they can still absolutely have all of that.
Okay. Yeah, that's good to know. Because you're right, it is. I mean, you're saying it's a total myth, and it is something that a lot of people think is that with a C-section, it's just you're gonna have different either you won't have issues, you're gonna have different issues. But now that I'm learning that it's also very hormonal too with those estrogen receptors, that is so interesting. So what is the typical condition or some typical conditions that you see women having? So we're talking about postpartum. I'm sure that that's something that you see a lot. Is there anything else that comes your way from women that you're just, it's like a telltale sign of like, oh yeah, this is what you have and this is our treatment plan forward? What does that typically look like?
So I would say that every patient that I have looks different, which is really fun. I see a lot of patients for either painful sex or pelvic pain in general. I see a lot of women before they get married, which is kind of cool because there's a lot of time to work on stuff. And pain is also something that takes a lot of time to improve. Um, Pain is really complex. I love working with pain. You see really cool improvements. Um, Apart from that, I see leakage problems, um, and I see prolapse problems, and you can also so leakage can also happen in different forms. So you can have urinary leakage, you can have fecal leakage as well, and so that's something that people actually don't talk about. It's kind of like the smearing of stool after you go to the bathroom, after you have a bowel movement, and maybe you just kind of keep wiping or something along those lines. So I see both of those prolapse symptoms, um, diastasis problems, if you could call that a problem. There are a lot of myths in that area too, or well, it's because that area continues to change with the evidence. So it's hard to keep up with sometimes, from a general public perspective. Um, what else do I see? Low back pain, hip pain. Um, yeah, and a lot of it too, because the problems with the pelvic floor isn't just, oh, it's looser or it's relaxed just because you had a birth. You could have tightness after a birth. You could have um, uncoordinated muscles after a birth. Um, you can have weak muscles after a birth. You can also have any of those without giving birth. Um, you could have totally uncoordinated muscles, pelvic floor muscles, without ever giving birth. You can have prolapse without ever giving birth. You can have leakage without ever giving birth. So I see a lot of those things. Trying to think if there's anything else in particular. Constipation. I see that. I've seen women who've had problems with pooping and constipation, and then they end up um, with kind of like an ileostomy or something like that. Yeah, lots of different things.
Yeah, I want to dive into a few of those. The first one being, earlier you said you often will see women before they get married.
Mhm.
Are they typically just coming to you to make sure like everything's good before they start having intercourse, or are they having problems already and they're expecting to have problems with intercourse? Like, what does that typically look like?
Yeah, a whole host of things. So I've had some people just say that they want to make sure that they're ready. Um, Maybe they've had some inklings that they've had pain before, because pain is not necessarily just with penetration. I've had women who, pain can affect your ability to use tampons. Pain can affect your ability to have OBGYN exams. Granted, if you're um, assuming that you haven't had sex before and you're getting married, you're probably not having an OBGYN speculum exam, right? But let's say that you have had sex before and you're getting pap smears or something like that. Um, and maybe the pap smear was really uncomfortable, or yeah, or they've never been able to use a tampon. I've seen women who have difficulty like wearing tight pants, like leggings are really uncomfortable and painful for them. So they'll have an idea that maybe it's something that they should get looked at. And typically too, it's not just pain at the pelvic floor. Again, pain is complex. And so you're going to see people with kind of more problems than just, pain at the pelvic floor. Maybe they have a lot of headaches. Maybe they have like fibromyalgia type symptoms, or like they're just like their body's just like very sensitive to things. That's a pretty typical profile. And that's kind of what takes a long time to improve, because pain is this whole body experience sometimes. It's not just local, like, oh, I stubbed my toe. It can be whole body for sure.
Okay. So then when you're evaluating someone's pain, so let's dive into pain during sex, because
Mhm.
that is something that I know so many women struggle
Mhm.
with and struggle through. And I don't believe that there is a one answer fits all to it. So it's like, oh, are you tight down there? Like, no, there's so many other reasons
Mhm.
for that. So can you dive into maybe why a woman might be experiencing that, or just pain in general? And then how do you evaluate that? How do you go? How do you start treatment for that? Just kind of dive into a little bit about your knowledge of that.
Oh gosh, so pain. Oh gosh, it's so complex. It could come from a host of things. So if you think in general about, um, how do I want to describe this? Because there's so many interesting studies on pain. So pain is something that does not actually happen from a tissue level itself. So we have all of these receptors in our body, in our muscles, in our skin and whatnot. Um, and there's actually no pain receptor. That there are receptors saying that there's something wrong with the tissue. Those are, nociceptive receptors. You have mechanoreceptors and whatnot, but you don't actually have a pain receptor. And so our body is constantly taking information from our surrounding environment, and it's saying, is this something that we need to be aware of? Is this painful? Is this something that we need to stop doing? And so it's constantly taking all of this information in. And when you have pain, your body says, oh, like this is something we should pay attention to. This is kind of our flashing light. Um, and it could be for any reason. It could be because the environment's bad. It could be because of our attitudes and beliefs about something. Um, and so when it comes to evaluating pain, I want to get the sense of what is going on in a person's life. Are there a lot of stressors? Are there other kinds of pain? How long have you had this pain? Because that can change things. If you've had pain for longer than 6 months, your brain changes the areas of the brain that are responsible for identifying that pain, and it actually becomes a lot more emotional, um, which is super fascinating to me. Um, and so is there a problem with the tissue itself, right? So there are all these different things that you need to get from a subjective perspective, like really understanding what's going on in a person's life. And um and you also kind of want to get a sense of sensitivity. So when it comes to an evaluation, I don't just look at the pelvic floor. Again, you look at the whole body. You look at how somebody stands on one leg. You look at areas of weakness, strength, and whatnot throughout their body, their hips, their core, their back. You look at their mobility. And so in pain, I do all the same things. Look at how they're taking a breath. Is their diaphragm able to move freely? And especially if somebody has pain, typically, you hold tension in different parts of your bodies, whether it's your jaw or your shoulders and neck. Your pelvic floor is the same way. But if you're holding tension in different parts of your body, maybe you're not able to take a deep breath the way that you normally would. Maybe it's really shallow. Maybe it's a lot of your shoulders coming up. Um, and so we look at all of that. Now, if somebody has pelvic floor pain, we might not even be touching the pelvic floor that day when it comes to evaluating, right? Why are they having that pain? Is it because this is an area of the body that's really sensitive and vulnerable, and maybe they have a history of trauma down there? Maybe they have some beliefs from about down there that you want to be really sensitive to. And so maybe you work on just getting somebody used to looking at pelvises, because that's going to bring awareness of your brain to your pelvis. And so you look at pictures of the pelvis in different positions and whatnot. Looking at pictures of dancers is a really good way to do that, because their pelvises are everywhere. um, but something like that might be really useful. Certainly, without even going internally, you can do an external evaluation, and look at, are there really sensitive areas to touch? If I take, a Q-tip and I touch an area on the vulva, how sensitive is that? Is it painful to experience that light touch? And so we're constantly getting information about what is the type of pain that you're experiencing? Why are you experiencing that? And then can we bring that level of sensitivity down? And so again, that might not involve going into the pelvic floor at all. The first visit might not involve that, the first 5 visits. But eventually you're going to go into you'll go in. I would just use one finger for internal exams. So it's very different than an OBGYN exam. But you just use one finger and you're just putting your finger on a muscle and seeing how painful is it. And so there's this, I don't know if there's a misconception about this or not, because I'm in this space, but pelvic floor exams are not, it's not just like, we're not kneading out a muscle the way that you would get like a massage, right? You're giving input to the muscle. It's, firm, but you're not like kneading out a muscle. It should never hurt. You can have awareness to it, but really what we're doing is we're changing your nervous system's ability to identify the area. Yeah, that's a very long-winded way of answering that, but hopefully
No,
that gives
that was great. I want to actually continue on with this idea. So actually, my first question, and this is kind of, we'll come back into this, but my first question is, how in the world can you do this virtually? Like that has been, I recognize probably the internal exam is not a part of that, but
right.
how in the world can this be done virtually?
Yeah, so especially, so I'm going to back up for a second. Especially when it comes with pain, there are 3 different areas that I'm really looking at. What's happening locally, right? So what's happening at the pelvic floor itself? What's happening outside of the pelvic floor? Because different strength and muscle imbalances throughout your mobility imbalances throughout the body can affect what's happening at the pelvis and the pelvic floor. And so sometimes it's as simple as fixing your hip strength is going to affect the load that's on your pelvic floor. And so then all of a sudden you're like, oh wow, I don't have pain. Now that's not my typical first line treatment with somebody who has chronic pain or persistent pain, but certainly happens, especially if someone's postpartum, has some pain from birth. That can be very simple. But then the big one would be looking at the central nervous system, and this is really where you can do a lot virtually, because there are a lot of ways to address the nervous system itself. And so identifying those different factors, there are plenty of exercises that help to promote relaxation of the pelvic floor. Helping to teach someone how to breathe is always nice, but we also need to move past breathing too at some point. I think that there's a lot of exposure to, just diaphragmatic breathe your way out of things. And I am a big fan of diaphragmatic breathing, but it is not the only thing that gets people better. So it's really a whole body approach. There are lifestyle factors that you can address virtually as well. Like things going on in someone's life and just checking in with those things. But that's also why I'm typically not seeing someone virtually every week. There are a lot of things to work on outside of that, but totally effective. And mindfulness can be really, really useful in something like this. Just having awareness of, when do I feel the tension in my pelvic floor? Am I clenching my butt? What am I doing? What's happening during my day? Is my 3-year-old screaming at me and I, feel like I'm clenching everything and I feel all of my pain symptoms, right? That, like, you can bring total awareness if it's something related to sex. what is your mindset before going into that? Are you nervous? Are you anxious? Are you anticipating what's going on? And so, yeah, there are a lot of ways to work on this virtually. And again, totally effective.
Yeah. Okay. Thank you for answering that. Because this whole time I'm like, how in the world can this be done
Mhm.
virtually? That is awesome.
Yeah. Okay. I'm going to interrupt for a
Yeah,
moment.
please.
And certainly, there is a time and a place for, like and this is somebody who's, interested and willing to do this. You never force this on anyone, but like wand work, or dilator work. I like to have people use their own thumbs, because then you are in control of what you're doing.
Mm.
Um, and just, the education on, I have like little diagrams, and I know that I don't think that people, I think this is just an audio podcast, but like I
Yes,
have
it
like
is.
little diagrams, and I'm like holding up one right now. Like, this is the pelvic floor. These are the muscles in the pelvic floor. This is the opening for and so we go through that, all virtually as well.
Okay. That is awesome. Talking about that mind to muscle connection, because I think that is when I, at least in my small amount of knowledge on pelvic floor physical therapy, I think most people just think, like, when it comes to painful sex, oh, you might just be tight in your vaginal canal. And so going to a pelvic floor physical therapist, they're going to help loosen those muscles, and then you're not going to have pain anymore. Great. But from what I'm hearing from you, well, and obviously it's so much more than that. Um, and you said something earlier about giving your brain a recognition of your pelvic floor, like
Mhm.
seeing pictures of pelvises or of dancers who are moving their pelvises, so you can actually see that, just giving your brain that connection. Because I think of other exercises, like I do Pilates.
Mhm.
That is my workout. I love Pilates, and the reason I love it is because it gives you that mind to muscle connection.
Mhm.
The exercises are very slow and controlled. And so you have so much, there's a connection being built there to recognize, okay, which muscle am I working right now, and how, making sure that my core is being strong while I do this, so that I'm not using
Mhm.
my back too much, or, there's so much connection there. And so I find it very interesting that, especially if you're doing an internal exam, you're not only just loosening the muscles, or at least, kind of working them out, but you're giving your brain a connection to this muscle. And that, I think, is really helpful, especially in painful sex, because you can be a lot more mindful of, oh, am I clenching right now? Oh, like,
Mhm.
what is thing in my brain right now that could be causing, or could be at least putting input into this pain. I want to get into as well how stress affects
Mm.
the pain, and also how trauma can affect that. Can you go in a little bit? I
Yep.
know that
Yep.
they're related, but they're very separate things. So can you kind of go into that a little bit?
So, okay, for regarding stress, have you ever had a night of or a night where you didn't sleep, and then the next day you feel really irritable about, regarding things that wouldn't normally bother you?
Yes.
Yeah.
Yes, I have.
Yes. So every little thing bothers you, and that is exactly what happens with stress in your body. Um, and that's exactly how stress can bother you. Um, so that I think that's probably the simplest, um, explanation of that, because everything's heightened. All of you're just very sensitive. Your body's very sensitive. Areas that are painful are significantly more painful. So stress is a big thing, and that's something that I like to bring awareness to for people. Um, Now, trauma, yeah. So it's we have lots of different types of trauma. Certainly sexual trauma. Um, can affect your association with your pelvis, right? With your pelvic floor, with sex, with even just defecating, right? Like even just pooping. Um, everything can just kind of like bring tightness, bring, tension to that area. Um, but certainly, uh, birthing trauma as well. Whether that's I don't even think that like tears aren't the issue. It's have you like what was your association with your birth is probably closer to it. Um, because whether or not you tore, yes, there if you had a grade 4 tear, um, then that's going to affect, your ability perhaps to um like to hold your stool or something like that. But regarding pain, it's the same kind of same kind of thing. Like these outside stressors are affecting an area of your body that you have this heightened awareness to that you normally don't think about. You normally don't think about your pelvic floor. You normally don't think about your pelvis. And so you have these outside stressors, these outside events in your life that are bringing more awareness to this area that like you're normally like, oh, I have this. Um, but you're totally aware of it now. And that's why something like a graded imagery or like looking at pelvises can be effective because you're stimulating your brain at like a sub-threshold level. You're not doing anything to the pelvis itself, which is already has this heightened awareness, and so you're bringing awareness to an area at a very sub-threshold, sub-threat level, and that can be pretty effective.
Okay. Now, when you're treating somebody that is experiencing pain, let's just call it pain during
Mhm.
intercourse, um, what I guess I have kind of multiple questions around this, but I guess the first one is, what is the typical kind of pain that you're seeing? Like, do most women experience pain just with penetration, or is there
Mm.
pain outside of that? And like, what I know we just talked about there being a plethora of reasons for that, stress or trauma, hormone levels,
Mhm.
tightness. Like, obviously, there's plenty of reasons for that, but like, what is the typical evaluation and treatment look like for somebody who's experiencing that pain? And what is a typical
Mm.
kind of pain that you're seeing?
Um, so it's variable. It depends, which is never the answer anyone likes. But um, let's look at like pain with penetration, for example. That's going to be perhaps a little bit more superficial. So like at the vaginal opening itself, it might, it might just be like a light massage with coupled with breathing, or I like to move people's hips around while they're doing that. But just to kind of get them to breathe and to relax. And as you're creating this new length in the muscle, then you need to actually have someone be able to use it. So a contract and a relax, and it's surprising how it's not. Maybe it's surprising, maybe it's not, but it can be surprising how difficult the relaxation part um,
Mm,
can be. I mean, I had somebody who thought that she um, was bearing down, like, trying to get that full lengthening, but she was actually contracting her muscles. And so bringing awareness to this area, getting this coordination is actually very important, because we want all of our muscles to be able to go through their full length. We want them to be able to contract and relax fully. So helping the pelvic floor do that is really nice. And that also brings more blood flow to the area and whatnot, and can help with um, just general healing. But then if it tends to be like a deeper pain, so perhaps like during intercourse, it's perhaps more with, this is why I usually ask, is it pain with insertion or deep thrust? And so if that deeper pain, that could be, the deeper layers of the pelvic floor, that can be more related to um, mechanics of outside of the pelvis as well. And so if we work on, hip strength or core strength or whatnot, or lengthening the muscle, um, by working on a specific exercise, then that can be very helpful as well. So yeah, so certainly massage to the area is helpful, but that's not all we do.
okay. Yeah, and actually I want to get into that pain of like the pain in deep thrusting. And the reason for that is because uh, thinking of it more on a level of fertility and fertility, like reproductive issues, do you ever see women having that type of pain and it not only being a muscle or mechanical issue, but it also being maybe a sign of like, I'm just thinking like endometriosis possibly,
Mm.
or like how does that play a role into that type of pain? Because I'm just thinking endometriosis is coming to my head because there are
Mhm.
cells growing where they're not supposed to be growing. And
Yeah.
so, and I'm thinking like, especially with during intercourse with deep thrusting, that playing a role, like going further into the pelvic floor, going further into the body. I'm just thinking, could that be playing a role into the pain? So it's not only a physical therapy issue, but it's also this hormonal or reproductive issue. Do you
Yeah.
ever see that?
Yeah, so I see a lot of endometriosis patients actually, because it's the cyclical problem, right? It's in
Right.
cyclical with yes, with the cycle, but when I'm saying cyclical here, I'm talking about this feedback loop. So you're having this this moment of intense pain with your period, and then what do you do? What does your body naturally do in response to that? You're going to curl up in a ball, you're going to tense your muscles, you're going to try to soften the pain physically as best as you can. You can't really do that, right? But your body's going to attempt to protect you, to guard you from that. And so as that happens, you get this tension in the pelvic floor. There's increased, inflammation perhaps in the area because there is that tension in the pelvic floor and it's not um, moving from a muscular perspective as much. So you're not getting as good of blood flow to the area. That can certainly happen. But then you're getting pain. And I see so many women who have endometriosis also have painful sex because of that tension and whatnot. Um, and so I'm not going to get rid of your endometriosis pain, but if you can decrease the pain in other areas of your body, um, right? So if you are very, like, let's say that your body's really sensitive. Let's say that you have neck pain and foot pain and pelvic floor pain. If you addressed all of those different areas of pain, you're going to be lowering that threshold, or you're not lowering the threshold, you're going to be lowering the sensitivity. And so is there a chance that your endometriosis pain gets a little bit better? Maybe. There is a chance because you're not having as many other pain inputs. Um, and so, while I'm certainly not affecting the endometriosis itself, um, decreasing pain in the rest of your body can only be helpful. Advocating for exercise can only be helpful with management of those symptoms. But regarding deep thrust, you'll see different profiles. It's not necessarily a deeper pain associated with endo versus not. You're just going to have pain, and that person could just as easily have um, insertional pain as anything else.
Yeah. Okay, that is helpful. So then what is the typical I keep asking you typical, and I'm realizing there's not really anything
Mm-mm.
typical.
No,
It's not
everyone's
a
so
one size
different.
fits all here. Yeah, and like especially with pain, there's different reasons for that. Or even with postpartum issues,
Yes,
there's different reasons for that. And so,
yes.
yeah, it's hard to say like, okay, because what I was going to ask is how long does it typically
Oh,
take for somebody to maybe be
yeah.
healed or to not experience pain or to be able to hold in their pee, like
So
is there a length of time that you see that's kind of like the
yeah,
golden number?
we're about to say it depends. Yeah, so it depends on a few things. So first of all, something like pain, I that's so hard to say. I see people for a long period of time with pain, but I don't see people, I'm not seeing you every week. I might see you monthly. I might, it's going to fit your schedule. Also, remember that progress is never linear, and um so people are going to have women or men, I don't see men, but like women are going to have different um periods where they feel really good and then all of a sudden it's worse and then they're better. You're going to take 3 steps forward, 2 steps back kind of a situation all the time. And so pain takes time. I've seen women for long periods of time over this. I would say expect it to take a while. It does not need to take over your life though, which is also why I don't see people with that frequency, with a huge frequency. But then regarding like postpartum issues, so that's going to depend on like where are you postpartum? What were you doing during your pregnancy? How active are you in general? What's your body awareness? Those I can see getting better much faster. And so it's bringing different awareness to your body, giving you the right cues to activate certain things, giving you the right exercises, to help your core or to help your hips, or I keep saying your core and your hips, or what about your mobility, your thoracic, your back mobility and whatnot. But yeah, it's giving you the right exercises, the right cues, the right progressions. And you'll see someone postpartum will be a lot, depending, will be a lot quicker. Because also once you start really doing things consistently postpartum, like you get better really, like there's a lot of room for improvement. So you get better really quickly. Um, yeah, I could keep going on that, but I'm going to pause
Yeah.
there.
Yeah. No, that's great. I say last question. Who knows if that's actually going to be the case, but I cannot leave this conversation without talking about eliminating seminal fluid. So
Mhm.
when we're in like the fertility awareness space,
Mhm.
NFP space, seminal fluid from your husband looks 100% like cervical mucus, and it can be
Mhm.
really a real struggle for women to eliminate this seminal fluid so that it's not continuing to confuse your observations and make
Yeah.
you look way more fertile than you actually are,
Yeah.
which could then lead to unnecessary abstinence, things like that. So
Mhm.
I this is something that even as a fertility awareness instructor, I really struggle to help my clients in this area, because the typical way that we would say, okay, to eliminate the seminal fluid so it's not continuing to be a discharge the next day and
Mhm.
using your observations, I would say, okay, go to the bathroom within an hour after intercourse to urinate, and then do bear downs and then about 5 Kegels, alternating that 3 times. And when
Mhm.
you mentioned earlier that you had a woman who thought she was bearing down and then actually contracting, I'm like, oh my gosh, like
Yeah.
how in the world? Like there's so
Yeah.
much to this. So I'll tell them to do 1 bear down, 5 Kegels, alternating that 3 times. That's kind of like the starting point, and then just to wipe all the seminal fluid away.
Mhm.
If you're constantly seeing mucus the next day, then that's usually a telltale sign of like, okay, we need to work on that elimination. So I'll usually up the amount of Kegels or up the alternations, or maybe bend forward while you're
Mhm.
doing it, right? So
Mhm.
there's different things that I have, but I would love to hear your take on that and how just you're smiling right now, so I know you have thoughts. Tell me all your thoughts.
Yeah. Yeah, yeah. I think a lot of people don't realize there I think relaxation of the pelvic floor is really hard if you don't have an awareness of it to begin with. And so so like to that point, um, I see a lot of people have issues even just giving birth, because it's not just how am I pushing, it's are you able to relax your pelvic floor? And that can be really challenging for a lot of people. Again, like my wonderful patient, she's so lovely. And when we checked her ability to bear down, I said, "You are contracting like really hard." And she said, "No, no, I'm not." But that's actually not uncommon. That's something that I've seen many, many times. And so this coordination thing is really difficult. Um, what is my advice here? Actually, the toilet is actually one of my favorite places to teach um, that full relaxation of the pelvic floor or the bearing down. Because I mean, this is going to be a weird analogy, but I mean, like if you think of like your pelvic floor as like an A-frame house, right? You have like your attic, your first floor, and your basement, and we're hopefully living on our first floor. Um, and so when you contract, you're going into the attic. When you bear down, it's not just relaxing; it's bearing down. You're going into the basement. And that's a visual I sometimes give people, but a great place to practice that is on the toilet because your body's already kind of in this position where um, it's a little bit stretched out, and so it's easier to go into the basement. You could, I would say, like it's a similar motion to pooping, but some people contract when they poop too. Um, So what I like to teach is just in general, is breathing and just kind of allowing your body to experience what it's like to go into the basement. So to experience that stretching and elongation. And then what you want to do when you bear down is you allow it to lengthen, and then you want to push, right? So bearing down is an elongation of your pelvic floor and then pressure down on top of it. Now you can push with your mouth open or like a open glottis. Or you can push like breathing out. That's a way that I often tell people to do it, just in general. So that kind of prevents you from fully contracting if you are contracting. So breathing out while you're pushing. Um, um, I'm not going to demonize holding your breath and pushing as long as you know what you're doing. So if you know that your pelvic floor is lengthened and you're able to do that, then go ahead. It's not going to hurt you doing it a few times a month. But yeah, I think probably breathing out while you feel like your body's able to get that lengthening of the pelvic floor, and then pushing down would be helpful. So yeah, so breathing, kind of working on like just experiencing what that lengthened position feels like first, and then bearing down.
Okay. And then what about with Kegels? Because there are so many times that actually when I teach this, every single client I have, I'm always like, what is a Kegel? Because I think in our heads, we think we know what a Kegel is, or actually the typical response is, I think I know what it is, but can you tell me?
Yeah.
So kind of go into that. How do you correctly do a Kegel?
So a Kegel is a pelvic floor muscle contraction. There are several ways to cue a Kegel. We find it most effective when you can confirm that that's what someone's doing, right? So usually digitally, like with a finger. And so you can cue stop a stream of urine. That is one that has been very controversial, but I think recent studies have shown that actually does effectively get someone to perform a Kegel. And then you could also do like hold in. I want you to do something like you're holding in poop. So like you can do like a front door Kegel, a back door Kegel is kind of some other language that I've heard. There's no right cueing, whatever works for you from that perspective. But the big thing with a Kegel, excuse me, this is where it gets particularly important with the pelvic pain or the pelvic tension patients or people in general, is that there can be a real difficulty with relaxing after the Kegel. And so you can perform the Kegel, but then have really hard time relaxing. And so it might be useful to give a little bit of time before you do the next one, depending on who you are. But typically, again, I like the toilet for this to learn it, because you can like feel the lift. Yeah, you could feel the lift there. Now, we could go into a whole tangent on Kegels in general, which I'm happy to do, but
No,
that's what I will say.
I've held you for a long time because this is so interesting. I guess my last question on that is, if somebody is really struggling with seeing mucus, which may be seminal fluid the next day, the tool in my toolbox is just to increase alternations of bearing down and Kegels, or increase the amount of Kegels. Do you have any other recommendations?
That's probably the best thing that you can do, but I would say give yourself time between your Kegels, and because that could be your body's just unable to go through that full range of motion of those muscles. And so if you are to, let's say, like, make a fist right now, if you're to make a fist and you are to make a tighter fist, so make a tighter fist and then relax a little bit, but not all the way, and then make a tighter fist again, and then relax a little bit, not all the way, and then make a tighter fist again. That's what you could be doing with your Kegels, and that's why you might not be able to eliminate all of the fluid. Whereas if you make that fist, then you make a tighter fist and then relax it fully, like open hand, and then make a tighter fist and then relax it fully, right? This is the similar idea as to like blood flow in the pelvic floor muscles in general. And so the more you're able to fully contract and fully relax, the better you will be able to eliminate. And so that's just a, general pelvic, reasons why it's good to have good pelvic health. I wouldn't stress about it, but, might be a sign that, getting coordination down there might be useful.
Yeah. That fist analogy is golden. I'm going to start using that now. That is
Good.
so good. So good. Emily, it has been an absolute pleasure to talk to you. This has been such a fruitful conversation, at least for me. I've learned so much from you just in the last hour. Before we leave, can you tell listeners where to find you?
Yeah, you can find me. I'm just on Instagram. I am trying to get back onto Instagram. I took a very long hiatus from it, but I'm at Fiat Physical Therapy. You can find me online at www.fiatphysicaltherapy.com. I am taking new patients. We are working out a schedule right now just because we just moved back to the Virginia area and whatnot, but I'm always happy to talk to people, answer questions, and whatnot.
Awesome. Thank you so much, Emily.
You're welcome. Thank you.
Thanks for listening to the Truth and Fertility podcast. If you are enjoying this content, please leave a 5-star review. That helps me tremendously. For more information about learning to chart your fertility cycle, you can visit truthandfertility.com, and I'll talk to you guys again next week.